As the coronavirus pandemic grinds on, we're all becoming kind of exhausted by the precautions we're being asked to take and the limitations it's put on our activities. But if we don't follow those precautions, then we're in for a long haul, especially as the winter months come in and infection rates continue to rise. So let's see if we can understand a little bit more about what those precautions are expected to do, because in understanding it, perhaps we can follow them more closely. And in doing that, we may be able to reduce the time in which we have to face those further restrictions. Before we begin that conversation, though, it's important that we understand the limitations of this presentation. This is not intended to provide medical advice or in any way to suggest that you behave in some way that differs from what your local health authorities are advising. This is, as we've already said, simply an attempt to help people understand what the precautions are so that you have a better sense of why you're being asked to do it. Let's start with some basic biology. To begin with, you'll hear the term coronavirus and COVID-19 sometimes used interchangeably, and you should understand that when you hear the term coronavirus, they're talking about the organism that causes the illness. COVID-19 is the illness. Now, beyond that, you should also understand that when we're talking about a virus, it has some very distinct characteristics that separate it from other things that cause illness among us. The most common other forms of microbe that cause illness would be mold or bacteria. There are various others, but these are the three that we see most commonly, and it's important to understand the distinction between them. One of the chief things is that a virus, as in coronavirus, is much, much smaller than any of the other microbes that we have to deal with, and that can have quite an impact on how we treat them and the sorts of risk we have to be prepared for. So why is it important that we distinguish a virus from other forms of microbes? Well, as we've already heard, they are much smaller, and that can have an impact on the steps we have available to us to control their spread. One of the things that is widely misunderstood is that antibiotics don't work on viruses. Antibiotics work on bacterial infections. And in fact, we don't have a lot of drugs that are highly effective on viruses. In recent years, some have been developed, but to a large extent, they help to reduce the symptoms or perhaps shorten the recovery time. But ultimately, in most cases, recovery from a virus depends on our own immune system learning how to attack it within our bodies so that eventually we develop antibodies and we overcome the virus through our own immune system. We should also understand that different viruses transmit in different ways, and that has quite an impact on the complications we see with COVID-19 and the steps we must take in order to try and control it. So what's so special about coronavirus and the COVID-19 disease that it causes? Well, to begin with, it's a virus that hasn't been present in the human population up to now, which means there aren't any of us that are carrying a pre-existing immunity to it. Now, you've probably heard of herd immunity and you know something of the debate about that, but that's something that's only achieved at a fairly high price. In order to achieve herd immunity in the absence of a vaccine, a large number of people have to contract the disease, and since it has a fairly high mortality rate and an even higher serious infection rate, that's a high risk thing for us to do. But what makes this disease particularly dangerous is latency. That is to say that somebody can have the disease, they can carry and they can infect other people without any indication that they've got it. Other diseases like SARS and Ebola can be just as dangerous for those who contract it, but they show themselves in the form of symptoms around the same time as a person becomes contagious. And so when they have the disease, it's evident and they can very quickly take precautions to avoid other people becoming exposed. That's not the case in many instances of coronavirus infection. What completes the one-two punch that makes coronavirus so dangerous is the way in which it spreads. Now, there are other frightening viruses that cause rather nasty diseases. Ebola, HIV, rabies, they're all frightening, but they are spread by the exchange of bodily fluids, and that requires fairly close contact between the person who's carrying the virus and the next victim. Coronavirus and COVID-19 are spread through the air we exhale, which means that a single carrier can spread the virus to a far wider range of people than it would if it required the exchange of bodily fluids. Now, as you may realize, SARS was another deadly disease that we have managed to wrestle under control. But remember from the last slide, SARS is a disease that shows itself as symptoms almost at the same time as a person becomes contagious, so it doesn't have that latency. So those two things combined for coronavirus, the fact that it's spread in the air we breathe and the fact that we can't identify people who are potential carriers as early as we wish, those two things cause it to be a much more dangerous public health hazard than any of these other diseases currently are. So the public debate with how we confront the pandemic in front of us right now tends to fall into two broad camps. There are those who think that allowing it to run its course to achieve herd immunity is the only thing we can do, but as we've discussed already, that's a high risk, not necessary. We don't necessarily know the path that would take. And let's restate, a large number of people run the risk of dying if we allow the virus to pass through the population in an effort to achieve that herd immunity. Not only that, an even larger number of people will require hospitalization, and in Canada, that could require up to 40 times as many hospital beds as we have in the country. So if attempting to achieve that herd immunity through allowing the virus to proceed among the population, if that's a high risk strategy that we don't want to take, and in the absence of a vaccine, at least for the time being, then we are faced with the public health priority being trying to limit its spread. And that is complicated by the fact that we don't know who carries it. We're bearing in mind that people could be carriers, could be infectious without even knowing it, which means we have to behave in a way as if everybody potentially does, because none of us can know categorically that we do not. And that, unfortunately, and one of the things that causes so much frustration for us, is it compels us to some behavior changes that really intrude on our quality of life. They're directed at reducing the number of cases as much as possible and allowing for the fact that there may still be some cases circulating, trying to reduce the likelihood of spread from contact between one person and another. Those two broad public health objectives, reducing the number of cases that are circulating and reducing the probability of transmission when there is contact between a carrier, brings us to the 6 primary mitigation strategies that are being implemented right now. And we should understand that each of these steps is designed or intended to achieve a specific purpose of its own. So it's not like we can choose to follow one and do twice as much of it and choose to ignore another. We really do have to participate as effectively as we can in each of them. As we discuss the various mitigation strategies, we'll look at this common chart, and it starts with something labeled as you. Now that refers to each of us as individuals, because most of the mitigation requires that we have to take our own action to try and comply. It starts with the premise that for most of us, we have quite a number of interactions in our normal daily lives. On average, we might interact with 30 people from one day to the next. And with that number of interactions, if there's a virus circulating, there's a strong likelihood that we might come in contact with somebody who carries that virus and possibly contract it from that person. And if we continue to have our 30 daily contacts, there's the likelihood that we would again pass that on to those people that we interact with. And when the virus first hit our shores, the average reinfection rate, the average number of people that an infected person would pass it on to, was 3. Now, of course, some people there would be much more. You've heard of super spreader events, and then there were others where there were not quite so much. And of course, what would happen is those people, remember that in many cases, people don't know they're carrying the virus. They carry on about their lives having the average 30 daily contacts, and very quickly it cascades to more people. The effect of that uncontrolled cascade would be very quickly catastrophic. In March, we were seeing growth rates in infections of 15% compounded daily, and at that kind of growth rate, it would have taken less than 2 months for everyone in the country to be exposed to coronavirus. Now, what made it particularly tragic was that without us being aware of who had to take precautions, it was being passed on to enough people that in just 1 or 2 more rounds of it transmitting, the likelihood would be that someone would die. Fatality rates were as high as 5% of the people who contracted the disease were dying. That's a death rate that we couldn't tolerate. We've managed that so that it's not quite so high, but more recently, those rates are still running between 1 and 3%. So it's still a disease that we must treat as very dangerous, and we must take precautions so that people don't contract it. So with the lockdown, the primary strategy was to simply reduce the number of contacts we have. If we were having typically 30 a day and we reduced that by at least 2/3, and nobody was really setting targets, just saying stop doing certain activities so that you automatically have fewer contacts. The rationale that was that for many of us, we would not now come in contact with that potential carrier, which means we would not then start that cascade that very quickly saw it spread to enough people that before very long somebody would contract a fatal case of COVID-19. That lockdown was brutally expensive and crushingly intrusive, but it was effective. Within a number of weeks, we were allowed to open up our lives a little bit more, and we were allowed to have some contacts once again. But we have to remember the pain of that lockdown because it's something we certainly don't want to return to. So we have to pay particular attention to controlling the spread through the other mitigation strategies that are being expected of us. Where we can now look at opening up our worlds again. We can't still go to hockey games or soccer games, and we're still probably most of us a lot more reluctant about flying on airplanes, even though it is possible. The next thing we do, now that we're allowed to have more contact with a wider number of people, is to pay attention to what the nature of those contacts are. And the notion behind social distancing is, as the name implies, keep enough physical space between you and other people. The virus is not that mobile. It doesn't project itself very far away from somebody who, even if they do have it. So the objective is if you don't get too close to people, then you improve the chances that you will encounter somebody without contracting the virus. Is it a perfect solution? Do we know precisely how far that distance needs to be? No. The 6-foot rule applies, or the 2-meter rule applies. Does it mean you couldn't possibly pick it up from that distance? Possibly you could. What we do know is you're going to be a lot safer at 2-meter distance than you will at 1 meter, or you will at something less than that. So maintain that distance. The virus might still be coming off somebody that you encounter, but you're less likely to pick it up. Social distancing is, just as the name implies, put some distance between you and the possibility that somebody else might have it. When it comes to testing, what we're trying to do now is identify if you've got that virus, find out early. Find out so that it's not going to change your outlook. You still have the virus. What it's going to do is it's going to alert you to drastically reduce the number of contacts you have. You will be asked to isolate, which should ideally bring you down so you have no unprotected contacts. But really, realistically, what we're trying to achieve is, rather than you having those potentially 30 or plus encounters a day, that number is reduced so much so that you don't actually have enough contacts to transmit to those 3 additional people that statistics say you would otherwise transmit it to. You might pass it on to one other person. And so the point behind contact tracing, so if we've identified you as a carrier, we then want to know everybody you've had in contact with so that we can then go out to all those people and alert them that they have potentially been exposed, and they in turn should drastically reduce the number of contacts they have. If they have picked up the virus from you, does it mean that they're not going to be contagious? No, it doesn't. It just is, what it's saying is limit the number of people you have any contact with so that if in fact you are contagious, again, you don't have enough encounters with other people to pass the virus on to that statistical 3 additional people. You might pass it on to 1 person. So if we can do this, if we can make sure by testing that people's behavior has changed, that their social encounters are limited, and they have fewer opportunities to transmit the virus, it can have a dramatic impact on how widespread the virus is in the environment. This brings us to the behavior change that many of us find the most intrusive, and in fact, some of us are quite militant about. And Wearing a mask may seem like it's asking too much, particularly if somebody believes that the purpose of the mask is to protect themselves, as if the mask is going to eliminate the virus that they inhale. And some people might even look at that and say they don't believe it. Well, that's fair enough, but in fact, what the purpose of a mask is to protect others from the breath that we exhale. So please don't get the impression that it's your choice to make simply because you're willing to take the risk. Remember, none of us know if we're carrying the virus on any given day, and so the purpose of wearing a mask is so that we don't inadvertently transmit it to other people. Now, there are environments where a mask is used to protect the wearer. That would be in a clinical environment, but the mask is not a standalone. It's part of a much more complete set of personal protective equipment. So yes, it is used in certain places, but the reason most of us are being asked to wear a mask is to protect those around us. Now, if you're wondering what the benefit can be with all of us wearing masks, remember that what we're asking it to do is to reduce the spread of a virus that may be coming off our own breath. Remember, we don't know who may be carrying it. So if we all wear masks, the intention is can it limit the spread of our own breath that we exhale and the virus that it carries. Now, you might be able to picture this if we think about two rivers. One river that doesn't have any kind of obstacle as it flows into the ocean. The sediment spreads freely and carries far out into the ocean. Whereas another river where there may be something, a very thin barrier island, it doesn't really reduce the volume of water that flows into the ocean, but it does reduce the velocity that the water can carry out. And in simply doing that, you'll notice in this picture that beyond the barrier island, there's very little sediment. That's because there's some form of an obstruction that reduces the velocity of the water that's flowing. And similarly, a mask, it doesn't actually strip virus out of the air that we breathe. It doesn't take virus out of the air that we inhale. It simply reduces the velocity so that our breath doesn't spread as far, and therefore we are less likely, if we should happen to be a carrier without knowing it, we're less likely to transmit that to somebody else. And so we come to the sixth mitigation strategy. Now, this is different from the other five that we've discussed so far in that the others were all oriented to try to limit the spread of the virus through person-to-person contact. When we talk about hand washing or surface sanitation, this is the only time at which we're actively attempting to kill the virus. And that may sound as if it's the most effective way to do it, except we've discovered that the main mode of transmission is through the air we exhale and that close contact that people have. So environmental sanitation and washing hands is a very important thing to do, but it's oriented to the possibility that an infected person may have left a residue on a surface where someone else might come along and make contact with it and then pick it up for themselves. Bear in mind that when you sanitize either your hands or the environment or a surface, all you've done is kill the virus that may be there. It doesn't have any effect on what may happen after that. So surface sanitation, hand washing, very important method for protecting yourself, but don't assume because you've washed your hands or because you've washed a surface that it's going to remain virus free anytime into the future. It could very quickly become reinfected. So now in performing that surface sanitation, perhaps you use a product that promises to have ongoing germ killing actions. But if you do that, be careful that you read the label because while some of them will continue to kill germs, they may not be killing viruses. Be careful that you read the label and understand exactly what it is they promise to do. If they say they killed mold and they kill bacteria, that's not a promise that it will continue to kill viruses. So be careful if you're using a product such as that. It's also important that you recognize the limitation of wearing gloves. Gloves would be like any other surface. They start out sanitary and virus-free, but they can very quickly pick up virus if it's in the environment or if it's somewhere that you've touched. So don't presume that wearing gloves is some form of protection that carries on. The only place where gloves are a viable form of protection is in perhaps a clinical environment where they change them frequently. Every time somebody moves from an area where there possibly could be contamination to a different area, they change their gloves. The gloves themselves are not the thing that's protecting you. It's the fact that there's a barrier and you can strip off that barrier every time you change your location. So don't assume that gloves offer some form of protection that in fact they don't. So to recap, we've all been asked to follow a range of precautions. Each of those precautions has a purpose of its own, and we can't compensate for failing to do one by attempting to do more of another. We have to recognize that we're being asked to do that not just to protect ourselves, but to protect those around us. The big problem with COVID-19 or coronavirus is that we don't know who might be carrying it. It could be us, it could be the people around us. So in the absence of that indication, we have to behave as if there's a possibility that each of us could be carrying it. It's frustrating, but it's something we have to do in order to avoid an ongoing pandemic that we simply can't control.